do have an amazing opportunity right now in NMOSD that we have higher efficacy evidence-based therapies that have recently been introduced. And I think prognostication early on is really key in order to develop a tailored and individualized treatment approach. So I think, we can look at demographic risk factors, clinical risk factors for a more severe disease course, and then any biomarkers that we can also use. So I think the biomarker research in NMOSD, it's exciting, but it's still in its infancy in terms of using GFAP, for example, to determine disease course. MRI, we're trying to gain better understanding of MRI and whether, for example, asymptomatic GAD-enhancing lesions could pose an early clue into how people are going to do. But that research is still evolving. We do have some identified demographic and clinical risk factors that are associated with disease course. So we know, for example, that individuals who have one severe relapse associated with poor recovery are more likely to have other relapses in the future that are also associated with poor recovery. If people have higher relapse rates early on, those are the people also you're going to be more concerned about. There are probably also, demographic risk factors associated with disease course. So it seems that non-whites with NMOSD also tend to have a somewhat worse disease course, particularly Blacks. I think we need to know more about whether that's related to underlying biological factors or socioeconomic factors. And age also probably plays a role in recovery from relapses, similar to MS. So sometimes we see younger individuals have higher relapse rates, but they also have better recovery from relapses. So I think age is another factor that has to be weighed in considering the optimal course of therapy.